Hello everyone, so welcome to yet another video and yet another topic. So today we'll be talking on the condition known as diphtheria. And basically diphtheria is a highly contagious bacterial infection and is usually caused by the bacterium known as Corynebacterium diphtheria. So it's Corynebacterium diphtheriae, so it primarily affects the throat and the upper respiratory tract, and it produces a particular toxin that can cause severe complications including heart damage, nerve damage, and respiratory failure. So this condition, diphtheria, it was once a leading cause of illness and death in children, but it has now become rare in many countries due to the widespread vaccine and just due to the widespread vaccination. So however, it still occurs in areas with low immunization coverage and in areas with poor healthcare access. So it still occurs in these areas, and prompt antibiotic treatment and antitoxin administration is very essential to prevent the severe complications, like I said in the beginning, to prevent heart damage, nerve damage. So giving the right treatment at the right time is essential to prevent these severe complications and to reduce the transmission too of this bacterial infection. So let's look at the background. So diphtheria, it has been known for centuries, and it was historically a major cause of childhood mortality. So the introduction of the diphtheria vaccine was made in the 20th century, and this introduction has significantly reduced the prevalence of this condition worldwide. So the disease is basically transmitted through respiratory droplets, direct contact with the infected wounds, or through contaminated objects. So the outbreaks, they still occur in areas where the vaccination rates are low, particularly in developing countries or regions that are affected by conflict and displacement. So without timely treatment, diphtheria can lead to severe organ damage and finally can lead to death. So let's look at the types. So there are two major forms of this diphtheria depending on the affected area. Number one, there is respiratory diphtheria, which is the most common and severe form. And this respiratory diphtheria, it affects the throat, it affects the tonsils, and it affects the nasal passages. So it is characterized by the formation of a thick grayish membrane in the throat, which can block the airways and can cause breathing difficulties. Then the second type is known as cutaneous diphtheria. So cutaneous diphtheria, it affects the skin, causing a chronic non-healing ulcer with a grayish membrane. So that is the peculiar sign about this cutaneous diphtheria. So it causes this chronic non-healing ulcer, and it usually has a membrane that is gray. So is more common. This cutaneous diphtheria is more common in tropical and overcrowded regions that usually have poor hygiene. So looking at the signs and symptoms, the symptoms of diphtheria, they usually appear 2 to 5 days after infection, after the individual has been infected through either the respiratory droplet, the direct contact, or through the contaminated object. So it occurs after 2 to 5 days. So this, for the respiratory symptoms that could be seen in this case, there's sore throat and is often severe and worsening because this bacteria targets the throat, the tonsils. So there's sore throat and is very severe, and then there's difficulty swallowing, there's hoarseness or loss of voice, fever and chills that could be mild or they could be moderate, then swollen glands in the neck, that leads to a bull neck appearance. So, and like I mentioned, thick grayish white membrane in the throat or tonsils, which may cause breathing obstruction. So these are the respiratory symptoms that would be seen. Therefore, systemic symptoms like weakness, fatigue, fast or irregular heartbeats, indicating that there's a heart complication. Then neurological symptoms such as muscle weakness or paralysis in very severe cases. Then when we're looking at the symptoms when it comes to cutaneous diphtheria, cutaneous symptoms like chronic skin ulcers with a grayish membrane, pain, redness, and there's usually swelling around the ulcer. So looking at the clinical presentation, this diphtheria, it typically presents as a severe throat infection with progressive airway obstruction, especially in children. So in mild cases, it may resemble a sore throat with a low-grade fever. But when you have severe cases, the toxin spreads and causes heart and nerve damage. So patients with cutaneous diphtheria usually present with persistent skin ulcers, which may be mistaken for other bacterial infections. So this is how the clinical presentation is. Then for the etiology, diphtheria is caused by the Corynebacterium diphtheriae, and this bacteria, it produces a toxin that damages tissues and leads to the formation of thick membrane in the throat and respiratory tract. So the bacteria spreads through respiratory droplets from an infected person coughing or an infected person sneezing, direct contact with skin to skin, infected skin lesion. So if someone that has the peculiar ulcer for the cutaneous diphtheria, if you should come in contact with this ulcer that the person has, you would get this cutaneous diphtheria by the direct contact of the infected skin lesion. Then contaminated surfaces too, or objects too, is also another way to get this infection. So the risk factors: number one, lack of vaccination or incomplete immunization is the first risk factor. Then living in crowded or unsanitary conditions, traveling to regions with active diphtheria outbreaks. So traveling to a region with this where diphtheria is very prevalent is a very high risk factor. Then in cases where you have immunocompromised individuals, such as those with malnutrition or chronic illness, so it's easy for them to pick up infections. And then when you are in close contact with an infected individual too, is also a risk factor. So looking at the anatomy and physiology, let's start like this. So the respiratory tract consists of the nose, the throat, the larynx, the trachea, and the lungs. So this Corynebacterium diphtheriae, it primarily affects the mucous membranes of the throat and the nasal passages. So the bacterial toxin, it inhibits protein synthesis, leading to cell death, tissue damage, and inflammation. So the heart, the nervous system, and the kidneys may be affected in severe cases. So this bacteria primarily targets the mucous membranes of the throat and the nasal passages, and it produces a toxin, and this toxin inhibits the protein synthesis and leads to cell death and causes tissue damage. So for the pathophysiology, how it works is that the bacteria enters the body through either the nose, the mouth, or the skin, and the toxin production begins. So as bacteria enters the body, it starts to produce the toxin, and this will lead to cell destruction and inflammation. And then a thick membrane forms in the throat, obstructing breathing and swallowing. And then the toxin spreads through the bloodstream, and it damages other organs, the heart, the nerves, the kidneys, and severe cases may lead to respiratory failure, paralysis, and heart complications. So how is this condition diagnosed? First, we can use a throat swab culture to detect this Corynebacterium diphtheriae. Then we could do PCR testing to confirm the toxin production. Then electrocardiogram and blood tests to assess the extent of the heart and the organ damage. And in terms of for cutaneous diphtheria, we could do the skin lesion culture. So we could take a part of the skin lesion, and take it to the lab to be cultured, and then it will detect this bacteria. So looking at the differential diagnosis, other conditions that could mimic the signs and symptoms of diphtheria, we have streptococcal throat infection, infectious mononucleosis, Vincent's angina, bacterial tracheitis, and acute epiglottis. So basically, infections that are mainly bound to the throat or to the upper respiratory tract could mirror the same signs and symptoms of this diphtheria. So for the management or the approach considerations, first, immediate isolation. So this just has to be the first thing, because this diphtheria is contagious. It's a highly contagious infection, and that means infected individuals, they have to be isolated to prevent transmission. And also, people that have been in close contact with them should receive prophylactic antibiotics and vaccination. Then giving antitoxin. So antitoxin administration should be the second thing. So diphtheria antitoxin, it neutralizes the circulating toxin, but it can't reverse existing organ damage. So it just helps to neutralize the toxin that could still be present in the blood. And it should be given as early as possible to prevent further complications. Then for antibiotic therapy, giving intravenous or oral antibiotics like penicillin or erythromycin can help to eliminate the bacteria. So this antibiotic therapy, the treatment usually lasts 14 days. And then in terms of when we want to give respiratory support, like airway management to critical patients, we can give them, we can put them on a ventilating system, especially people that have severe throat swelling. Then sometimes in severe cases, a procedure known as tracheostomy may be required. So other supportive cares that we could give, like intravenous fluids for hydration. Then for the pain, we could give analgesics. Then we could monitor for complications too, like myocarditis or paralysis. So looking at the prevention, routine childhood vaccinations with diphtheria, tetanus, and pertussis vaccine is very important, because most of the time, like they say, prevention is better than cure. So giving this routine vaccination is very is very much needed, because in cases where this condition has become so complicated, so severe, you will just be looking back and be wishing that you are just taking care of it when you could. So giving this diphtheria vaccine is very much important, very much needed. And then giving booster doses too every 10 years for a lifelong protection. Then also public health measures like giving hygiene education and outbreak control too is very needed for the prevention of this condition. Then for the prognosis, like I said, early treatment significantly improves the survival, and if left untreated, the mortality rate can be as high as 50% due to respiratory obstruction, heart failure, and neurological damage. So it's better for them to start early treatment once this infection is detected. And like I said before, vaccination remains the best preventive measure for this condition. So this is basically the breakdown of this condition known as diphtheria. Thank you.